Good morning. I was really pleased to be invited to speak here today, and I'm really pleased that I'm getting to share a stage with some of the excellent speakers in this session and throughout the day. I was also quite lucky, is that I think I was probably one of the last people to choose the topic of what I was going to talk about, so I got to see what everybody else had put down on the programme. And so when I was thinking about what would I talk to you about today, I thought I would try and give a different perspective around what you were going to hear. There'll be people talking about some of the things that are really important to the Department of Health around the 5-year forward view and around the NHS long-term plan. But I thought I wouldn't cover that ground, and probably not least because they'll probably do that much better than I will. What I thought I would do is give you a perspective on the kind of the wider cross-government work that happens alongside this, to kind of explain some of the thinking that goes on constantly kind of behind the scenes across government departments with ALBs and with stakeholders, so that we kind of keep ensuring that what we said we would deliver happens, and we keep looking forward to what other things we should be focusing on and where the challenges are coming from. What I'll try and do is outline that programme and how we look at the delivery landscape across the NHS and government. I'll try and explain a bit about the strategic approach that we try to take on an issue that is as wide as mental health, and I think Duncan really made the key point, is that in so many ways it's about how do you keep people well. It's more than just making good NHS services for people. And I'll try to explain a little bit about the opportunities and benefits of government for looking at mental health as a cross-government issue, because in putting in the effort to address it, there's many benefits that various parts of government get from it. The programme that we've got, is a very wide-ranging programme that goes across the NHS and it goes across government, taking into account the various things that people are impacted by society. And really, it kind of started from this kind of 5-year forward view for mental health, when we started seeing the whole kind of cross-government agenda as something that we had to pull together and start to look at. We had worked with various government departments in the years preceding that, but it was really the event of the 5-year forward view and some of the significant announcements on transforming mental health services that came from the Prime Minister at that time that helped us formulate this programme. And it keeps moving. I mean, what I've tried to illustrate there is that kind of to date with the 5-year forward view, there was a huge focus on expanding capacity and providing access, because we'd appreciated that we were starting from such a low position, and that's really what we had to address first. So the 5-year forward view set about doing that and implementing some of those things like waiting time standards, so that people could actually get access to timely access to mental health services. And we looked at things around expanding perinatal mental health, and more importantly, looking at how we expand children and young people's mental health. And really informed by big documents such as Future in Mind, which really led the way for how we're trying to expand children and young people's mental health services. And now that we're moving into the next phase and we have the NHS long-term plan, I'm really pleased that that seems to be moving away from expanding access and giving people easier access to care, but actually looking at the quality of care and looking more at the outcomes that come from that care, in when they're trying to set out how they will spend the settlement. But in addition to that, there's various other things that we have to do across government. It can't be dealt with purely through looking at NHS services and looking at the quality and outcomes that those deliver. If we kind of look at the kind of impact on people's lives from society and how that affects their mental health, then across government we have to look at all the various different policies that we have. And I remember several years ago when there was an EU joint action that was asking member states to look at how governments view mental health policy, and one of their objectives was that we should have mental health in every policy across government. And that makes a great deal of sense. And I think that's one of the things that we've tried to do. But to give you a bit of a scale of what we're doing, if you take the 5-year forward review and everything that said, and then if you take everything that's happening across government and the various big announcements that prime ministers have said, we've collected all of those and put those into a cross-government programme, and it represents over 100 separate commitments and things that we said we would do. And those range from the short to the medium term. Things will be ongoing, there'll be sustainable long-term objectives. But that is a substantial programme that we have to constantly speak to our cross-government colleagues about and hold them to account and challenge them and be accountable for. I've just tried to give you a few examples of what we've been achieving through that kind of cross-government programme. So we have made some progress, and we've been looking at transforming children and young people's services. We've been looking at substance misuse. We've been looking at mental health in the workplace, as well as the social attitudes to mental health. Duncan mentioned the Prevention Concordat, which is, I think, a really significant change in kind of challenging local government, that you should actually design mental health into your services from the beginning, so that you're actually thinking about those outcomes before you implement the policy. Another significant thing that we're doing is we are looking at the independent review of the Mental Health Act. That will be significant in helping us to get that legislation into the right place, so that the independent review completed at the end of last year, and we'll publish a white paper response about how we're going to do that at the end of this year. An example of kind of where some of the other government departments are moving with us, I've just mentioned there that they've been developing a mental health and wellbeing strategy for defence personnel. But we do various things, not just across defence, but across MOJ, who are implementing a significant prison safety strategy, which is looking at the wellbeing of prisoners, particularly looking at reducing self-inflicted deaths. I thought it would be useful to give you an example, and probably an area where I'm comfortable, that Jackie mentioned in my biography. But on the cross-government suicide prevention strategy, I think it's an illustration where we can actually make this work, and we can actually get a cross-government commitment to doing something. It's been a number of years in the making. If you like, we published a cross-government strategy in 2012, and then we updated some of the key areas for action in 2017. And it took us quite a number of years to kind of engage all of the government departments that may not have seen suicide prevention as actually relevant to them. And through doing that over a number of years, we've been able to actually develop a cross-government suicide prevention work plan. And it's quite different because for the first time, what we've been able to do is get every government department across health, justice, transport, environment, to all actually commit to something, and in a very public and transparent way say what it is they will do and give a time scale on when they will deliver it. And that's published for people to see, and it makes them accountable for doing that. And we update it on an annual basis. And what it's really been helped by is that we've had that direction from central government, from the top. We think we're certainly the first country in the UK to have a Minister for Suicide Prevention. We haven't found another suicide prevention minister anywhere else in the world, but I think we're kind of hesitating before we kind of say we've got the world's first. But doing things like that really helps drive that agenda by making these kind of issues far more visible, helps other government departments to come on board and do something. And we've achieved quite a lot through doing this. I've just tried to give you a few examples, but one of the most significant things that we did, and we did with Public Health England, is that we actually got every local authority to put in place their own suicide prevention plan that relates to the cross-government strategy. And then we got them to look at the quality of it. So it's not just good enough to have a plan. What do you think the plan's going to achieve, and how well do you think you're achieving it? And they've done that. And as a result, we've been able to announce some funding for them to help them to make those improvements. So kind of working together has really helped us to kind of tackle a difficult area, and how do you actually adapt your interventions on suicide prevention to meet the individual needs of communities around the country. But some of the other things that we've done is that we've done an extensive programme across the NHS, which is supported by £25 million over the next 3 years, and that will see every NHS area through the Sustainable and Transformation Partnerships receive funding to support that local suicide prevention planning in their area. We've been working with the Ministry of Justice, and they're implementing a prison safety programme across their whole estate, which is looking at suicide reduction in prisoners and training of staff. Department of Transport has been looking at this, and they've made a significant development where they've now ensured that every new train operating franchise now includes a commitment that they will address suicide prevention, which is quite a significant thing. And we've been working with the Government Equalities Office on the LGBT Action Plan, which is just looking at a particular group that is affected by suicide and have a higher risk of suicide than the general population. That's kind of covered what we said, what we said we would do. How are we doing it, and making sure people are accountable. But what we're also doing is we're constantly looking ahead, and we're looking at where are the new challenges coming from, and what are the new areas that we should be moving into. Because again, going back to what Duncan was saying, that this is actually about how life impacts you. The slide here, I don't imagine that you would try and read all that, but I think it gives a really good illustration of this is actually the challenge that we're looking at. Mental health is so widespread. There isn't a single driver. There isn't a few number of drivers of mental health. There are many factors at play constantly throughout your life. And what makes it even more difficult is the way that those factors overlap. So you'll have people that will just have multiple risk factors, one on top of the other, impacting their mental health. And so we at central government are trying to figure out what are the levers that actually central government have to try and influence some of those things. That was our attempt at trying to give some idea of the things that we would be looking at. I like the caveat at the bottom that kind of says, we don't think we've got them all. There's possibly more. And I'm sure there will be. But to try and translate that, this is why it matters to government, because when you look at all those overlapping factors and you look at how that is impacting people's life, then this is how it actually translates. And just giving some statistics to you, which I'm sure you have heard many times before, but 1 in 6 adults having common mental health disorders. 1 in 25 people aged 16 and over have severe mental health problems. 13 people every day take their life in England. That was according to 2017 statistics, and actually the 2018 statistics came out very recently. And unfortunately, after 3 years of decreasing suicide rates, they've now jumped back to where they were. So it's quite a serious issue. And of course, there's wider impacts and costs. There's huge cost to the economy of trying to deal with these problems. Needs to be looked at in a cross-government effort. Looking at some of these risk factors, what we've tried to do to illustrate why this should be important to every government department is we've tried to colour code some of these things. How we look at addressing all those overlapping factors is looking at the protective factors that we know help, and the things that we know we should be looking at to improve and strengthen, based on the risk factors that come out of those things. And so we've just tried to illustrate there that, you know, when you're talking about things like having a good quality, sustainable home, and that you're having emotional well-being, that you've got relationships, you know, those things can't be dealt with by health. They need to be dealt with on a much wider scale. So we're working with DFE, we work with the Ministry for Housing and Local Communities, we work with a broad range of people to actually, across government, we almost do our own awareness campaign to show them where they actually need to be involved and where these risk factors are impacting on them. If you take one of the big flagship programs that we've got, which one of the other speakers will be talking about today, the NHS Long-Term Plan, there's huge benefits for government wanting this to be delivered. There's various things within the NHS Long-Term Plan that, again, can't be delivered purely on an NHS platform. It needs to be looked at on a wider scale. And one of the things that we do at the Department of Health is we're very much the conduit and the driver to ensure that people across government are supporting these big flagships. If you look at things like gambling problems and rough sleepers, that's where we're able to work with our colleagues across government in Department for Digital, Culture, Media and Sport and with the Ministry for Housing and Communities to actually get them involved in this NHS-driven agenda to kind of change the impact on people's lives. And it has significant benefits for them. How we're doing this, what we're trying to do is look at where do we make the biggest impact by looking at where government departments are going. Previously, in the previous slides, I was talking about the 100 and some commitments that we actually have already said this is what we do. What we've been trying to do is look strategically across government to see what other people are doing, to see where it can be brought in. And through doing that, we've identified another 280 relevant work streams across government that are happening that are in some way addressing mental health. And the challenge there is to not only keep them going, but to bring them all together in a way that's aligned strategically so that they all help each other, so that they all impact in the right way. What I wanted to do is to give you a bit of a flavour of the things that we see important going forward in the examples that we've given there. And I think probably what you'll see from those examples is that they're not really related to health. But these are the things that we think are important that we have to look at going forward, which is housing in the built environment. There's a significant evidence base about the impact of poor quality housing on your physical and mental health and well-being. Debt, I think there's a growing evidence base about the impact of having debt on your mental health, but also the inequality of people with mental health who struggle with debt. Some of the things that have kind of been shaping that as well is the causes of debt, gambling addiction, areas like that. People in prison, I mean, a significant area, not just when they're in prison, but when they come out. So we're working with the MOJ about a pathway right through the custodial system. Work and welfare, incredibly important. The impact of welfare policies on people's health and well-being, and what more we can do to improve that. Strengthening the protective factors around children and young people's mental health, which is very much shaped by our children and young people's mental health being paper. And looking at the many other kind of early year vulnerabilities about the circumstances that people may be born into, possibly looking at kind of parental influences and all of those kind of wider things, because we recognize that dealing with this at the very earliest opportunity helps us to improve people's mental health moving forward. Really, just to make a conclusion, I think the thing I would say is that the culmination of all this work has probably enables us to be able to say that we have made some progress, but I think we're very acutely aware of the difference between the rhetoric at central government and the policies that we announce and the places that we want to go, but actually how that feels on the ground. And I just, I think there's so much more we need to do so that people actually feel the benefits of what we say we're doing. So I think there's a long way to go. But thank you.